Hello, everyone. My name is Nika, and it's a great honor to be here today. And first of all, I would like to thank all of you for actually showing up for women's health. I would like to underscore the importance of this event. And ultimately, I'm not here just to speak from the perspective of Ani, but ultimately as a woman today. The reason why this topic is so close to my heart is because I am a woman that went through the healthcare system. When it comes to the gut-brain immune system, I actually had a very severe case of a gut-brain interaction disorder. When I was 25, I went for a very routine wisdom tooth removal surgery. And I never really took painkillers in my life. Thankfully, I didn't need them. However, after that procedure, I was prescribed painkillers, and I took them because everyone takes them, right? However, I had an adverse event. We don't know enough about women's health, and women have a lot more adverse events than men do. Why? Because there is not enough research in the field of women's health. The field is severely underfunded, and that's why an event like this is bringing to the forefront everything that is not working as it should in this industry. I had this adverse event, and what happened next was something that literally changed my life 180%. I literally just took painkillers, and I started feeling burning pain in my stomach. I called my doctor after a day, and she told me, Nika, just drink some tea. You're not feeling any pain. That is one of the things that women experience on a daily level. They feel pain, and unfortunately, experts in the field tell them that it's really nothing. It went on for 3 days until finally I was admitted to the hospital. When I went for my checkup, what happened next was another experience where they told me, well, you're the youngest and obviously the healthiest person in this room, so why don't you wait and you will be the last one that we will do a checkup on. So I waited the whole day. I waited until the afternoon. I was alone in the waiting hall in the hospital. I didn't want to call my mother or anyone. I really didn't want to feel like a burden to my family or my friends. And at the end of that day, I did an endoscopy, and what I found out was that I had 3 stomach ulcers at once. Basically, the situation looks like this. I was on that table, and they had this tube that went all the way down to my stomach, and I heard the doctor saying, students, come here, we've never seen this. This young lady is an example of something of an extreme immune system reaction, and let's get her up and see what went on. It didn't really stop there. What happened next was that I went through the whole checkup, and after that, the doctor took me out in the hallway in front of all the other people and told me, you know, Nika, I didn't want to tell you this, but I know you young people are quite irresponsible in your behavior. So if I were you, because I've never seen an immune system so compromised, I would go and get tested for HIV. This happened in the hallway, in front of all the other people there. And I was alone, 25. My whole world was just like crashing down. And that's the reality of what women experience in the healthcare system. What happened next was maybe even worse than what happened initially, because I asked, well, I'm in a hospital. Can't I get tested here? And they told me, no, you need to go to one of those homosexual centers because we don't do that kind of testing here. So, long story short, turns out I don't have HIV, that was fine. But what happened next was they gave me another set of drugs. in order to now work on my gastric problem, because 3 stomach ulcers at once, it's quite a heavy problem. And then I had an adverse event to the drugs that I was given. So it went ultimately into one circle where my immune system kept reacting and I didn't know what to do. And the reason for that was also, again, because there is not enough research. There is not enough research in women. There is not enough research in young people. And we think aging happens only to the aging population, but everyone who undergoes the healthcare system at a young age knows that basically any condition or disease is just an accelerated aging process. So I didn't do any biological age tests at that moment in time because there weren't any around or I didn't know about them, but I know how I felt. I was 25 and I felt like I was 75. I couldn't leave my house when it was raining. I couldn't leave my house when it was windy, simply because my immune system would overreact immediately. Ultimately, I went on a journey of more than 2 years to heal myself and to bring myself where I am today in a state of greater resilience, of greater cognitive, immune, and muscular function. And I'm happy to be standing here with you today to talk about Ani and the work that we are pioneering and how that ties to metabolic health, longevity, gut microbiome, and ultimately affectoneuroimmunology, the scientific framework that we are pioneering. Now, this is just the beginning where I already explained a little bit in this story about funding on women's health research, so I'm not going to go into that again. And ultimately, I'm not the only one that went through such a situation. We now know that autoimmune disorders affect between 24 and 50 million Americans, but 4 out of 5 of them are women. 4 out of 5. We really don't know what is going on, and no one is doing enough research in that field. And if you were to look for a solution in such a case, there is no solution for you. So a part of that, what we need are N-of-1 solutions. We should not treat the patient as a condition or as a disease, but rather as a person experiencing different symptoms that, when coming together, form a pattern that we recognize as a certain condition or disease. And that is what we are doing at Ani, and we have been recognized in XPRIZE Healthspan and XPRIZE FSHD competitions. So XPRIZE Healthspan is the largest worldwide longevity competition. We are the only company globally to make it to the semifinals of Healthspan track and finals of FSHD. I've just come back from annual FSHD conference that happened in Amsterdam this year, where we have discussed how the loss of muscle function also ties into aging biology and health outcomes. Now, what we have applied with and the approach that we are pursuing is algorithmic polytherapy, as Judith so kindly introduced. We like to say that a longevity drug won't be a molecule but an algorithm, and that this algorithm will understand each and every individual on a longitudinal level and will understand what are the things needed for that specific person. If we look at a person, if we were to imagine a person as a book, and let's say there were certain pages that were just deleted or erased, what are the inputs, what are the letters that we need to provide in order to provide the right inputs, the right signals, to create the new letters again and to rewrite the pages towards coherence. So we are utilizing Multi-Omics suite. We are using our proprietary digital biomarkers to longitudinally monitor patients and healthy individuals in all of our studies. And we are really bringing to the forefront the N-of-1 personalized medicine approach. It all ties into affectoneuroimmunology, where we are looking at how do our psychological experiences, our emotions, our cognitive performance, how all of that drives different aging processes. so the biochemistry occurring in our body and ultimately shaping the experience of what we know as ourselves and the perception of the world around us, and ultimately how it drives aging and vice versa. We are targeting aging biology on a systemic level, really looking at all the different markers. So when we do our studies, we utilize everything, not just gut microbiome sequencing, but also proteomics, affectomics. We developed our longitudinal biomarker for looking at to evaluate one's psychology over a longer period of time through dynamic questionnaires. We also use, we look at different immunological markers and so on. Furthermore, we have built the world's largest longevity clinical pipeline with more than 3,100 participants. We are doing both healthy individuals and different diseases. Our focus areas include gastrointestinal disorders, pediatric conditions, neurological and neuromuscular conditions, systemic medicine and Healthspan in healthy cohorts, and the reason why I'm here today, also women's health, that is in preparation. When it comes to our intervention, our age biotics that also Judith mentioned, we have seen it in practice. We have seen a threefold increase in Faecalibacterium Prausnitzii in a gut-on-a-chip study that we've done. And basically what that means is that we are able to modulate the gut microbiome and its function. And the reason why such a thing is important is because, well, the gut microbiome, the gut dysbiosis, has recently been recognized as one of the hallmarks of aging. And it's one of the key underlying figures also when it comes to response to treatments. So I don't know if you're aware, but actually 50% of people don't respond to drugs they are given. So basically you go to a doctor and you get a drug, and it's half chance that you will actually respond to the treatment that you're given. And science has been recognizing that the role of gut microbiome in this response, what is actually dividing the non-responders from the responders. Furthermore, with age biotics, we've seen the restoration of gut barrier integrity, promotion of anti-inflammatory response, and in IBD gut-on-a-chip model, we've seen increase in butyrate production. Now, the reason why I'm pointing it out again is because butyrate production, short-chain fatty acid production is extremely important, not just in IBD, but also we know now in immunology, in cancer therapies, and so on. And in certain cases of cancer, when it comes to the difference between responders to non-responders rate, it can even be that up to 95% of people won't respond to treatment. So if you only have 5% chance to respond to treatment, what we are actually looking at is the potential of optimization of the gut microbiome environment as a co-therapy to exist in drugs in order to turn non-responders into responders. These are just examples of the importance of the gut microbiome environment for different therapies and how it affects furthermore, for example, sarcopenia. And personally, I think this is one very important topic, especially for women, when we are talking about frailty and muscle function, because it plays a key role to work on our muscle function and to preserve it for our resilience, brain capacity, and similar throughout our lifetimes. So when it comes to the studies that we are doing across the gut-host immune system, currently we have 2 ongoing studies in precancerous gastric conditions. We have 2 different trials in IBD. At the end of that story, my personal story, I went for a second opinion from another doctor, and that doctor said, well, now you're kind of fine, but now just take these pills for the rest of your life for gastric inflammation. What I did, I took that paper, I went out of that hospital, and I threw it in the garbage, and I decided to find my own way. But today, it turns out that doctor is handling 400 worst IBD cases in Croatia, And we are working together with him to bring a better personalized medicine to those patients. So there's a happy story behind it. Also, the reason why I'm in Europe today is because I usually live in San Francisco. So it's because we just started 4 of our pediatric trials, also one in IBD, another one in obesity, and they're all kicking off this week. We are also part of 7 large international consortiums with Wageningen, Vrije University, Eindhoven, and Radboud in the Netherlands. And there we are really working with European leading professors in the field of gut microbiome and host immune system. And finally, we are just starting our women's health program. If any one of you wants to reach out or join our trials, please reach out to me. Don't hesitate. As you have seen in affective neuroimmunology, we are working across many different conditions. And very soon we are kicking off a trial in breast cancer survivors because we want to longitudinally monitor changes and observe in women who are deemed healthy again after having gone through a very extreme condition, what is to map that state of health and to prevent recurrence of the disease. Furthermore, through our XPRIZE Healthspan studies, what we are looking at when it comes to women specifically, we will also be looking at the impact of menopause across a variety of different omics signatures, as I said, from proteomics, metagenomics, the gut, saliva, vaginal, and so on. So that's definitely something that we are bringing a spotlight on. Finally, the team, just to introduce a little bit about the people that are working on this. I have started Ani together with my co-founder Bruno, and Mirna is our PhD head of neuroscience, who is a joint PhD from University of Maastricht and Besta. We are also working with Besta, which is one of the best neurological centers in Europe. Then Evelyn Bischoff, who is actually speaking here in 2 days, so do come to her speech as well. She is our PI in XPRIZE Healthspan study, and also we work with Michael Snyder and Eric Worden. They're members of our scientific advisory board. And the primary Healthspan center is Sheba Medical Center, the 8th best hospital in the world. So one more time, I would like to thank you for this opportunity, and reach out to me. We are really looking forward to kick off our women's health program at Ani.